It's 6:10. The Centers for Disease Control reports 31 million Americans live with anemia. It's a common blood disorder, but what is it and how do you get it? In this week's Ask the Expert, I sit down with doctors at Bon Secours St. Francis to discuss anemia symptoms and treatment plans.
Anemia is a common blood disorder
where your body does not have enough red blood cells or hemoglobin, which is a protein inside the red blood cells that carries oxygen and delivers it to various tissues and organs in the body.
If the red blood cells do not have adequate oxygen, the body does not function properly.
And as a result, people can have effects anywhere from decreased energy level to effect on muscles, brain, lungs, as well as heart.
That's Dr. Zishan Ali. He's a board-certified hematologist and medical oncologist with Bon Secours St. Francis.
Anemia is diagnosed when hemoglobin drops below certain thresholds. For instance, in men, if hemoglobin drops below 13 gram per deciliter, in non-pregnant females, if it drops below 12 gram per deciliter.
In pregnant women or children less than 5 years old, that threshold is 11 grams per deciliter. Dr. Ali says symptoms vary from mild to severe.
Feeling cold all the time, headaches, restlessness in the legs, changes in the skin, hair, fatigue, non-refreshing sleep, and things of that nature.
He says it's important to know the symptoms to receive a proper diagnosis.
Pica, which is an unusual craving for non-food items such as such as clay or starch or ice. Very important to know that chewing ice constantly.
The population for the disorder is quite large.
There are certain patient and patient-related factors as well as populations which make people more prone to anemia. For instance, women of childbearing age, through breastfeeding,
through pregnancy, chronically ill patients, children younger than 5.
People who suffer from malabsorption syndromes, such as inflammatory bowel disease. There are certain socioeconomic groups.
Those who donate blood frequently or on certain types of medications are all more susceptible.
It also depends upon what is the cause of that. So, for instance, I'll talk about iron deficiency, which is the most common cause. We typically start off with oral iron supplementation.
Dr. Ali says the type of treatment depends on the type and severity of the anemia. For some, it could be adjusting your iron intake.
Appropriate iron supplementation can really help improve how people feel and function.
To submit a health topic for our Ask the Expert series, head to WSPA.com.